Greetings, House Scholars, and welcome back to the For Health Scholars channel. If this is your first time tuning in, welcome, welcome, welcome. My name is Dr. Orobosa, and I am the founder and host here at the For Health Scholars channel. I am so excited to have you on and watching this video. Make sure you watch what you need by subscribing to this channel and definitely turn on your post notifications so you don't miss out on upcoming videos that I'll be posting. Now, today's video is a good one, and it's a continuation of a video that I posted yesterday talking about different entry level healthcare jobs for healthcare administration professionals. Today, we're going to talk about the various entry level jobs you can work as a healthcare management professional. Now, if you're not sure what's the differences between healthcare management and administration, no worries, I got you covered. I did record a video, which I'll link in the box, that specifically talks about the differences between healthcare administration and management and exploring whether they are the same or different. So I encourage you to go to watch that video if you're not sure what the differences or the similarities are between being a healthcare administration professional and a healthcare management professional. But today, I want to talk about entry level healthcare management jobs. But before I do that, here's a few words from our sponsor. Do note that today's episode is sponsored by my course, which is titled From Healthcare Graduate to Hired. I'm so proud of this course, and I know that this is the course that you need if you are an active job seeker wanting to acquire a job in the healthcare space, particularly a non-clinical healthcare job. In this course, I walk you through my 5-step strategy on how to go from active job seeker to hired, as well as I talk about things that people are not necessarily sharing with you on how to acquire a job in a digital era. Because right now we are in a digital era, and many people, when you're looking for jobs, you're looking for these healthcare jobs online. So how do you navigate that process so that it is successful in helping you getting hired? Also in the course, you get a chance to work with me and the other students in the course. I review your resume and other job hunting documents. We work together on creating your personalized job hunting plan, because once again, the ultimate goal is to get hired. So definitely check out the course. You can sign up by accessing the link in the description box, and I look forward to seeing you on the other side. All right, so we are back, and without further ado, let's jump into the conversation. So, what are some entry level positions that you can work as a healthcare management professional? This is the $1,000,000 question. But before I answer that question, I want to talk about some of the core skills that you need as a healthcare management professional. These skills will definitely help you thrive in your healthcare management role. And so, the first skill is leadership. As a healthcare management professional, you need to have awesome leadership skills. An organization is just as strong as its leadership. And as a healthcare management professional, you are a part of the organization's overall leadership team. And as a healthcare manager, you should be able to have leadership skills that effectively lead and help the organization achieve their goals, but also manage various teams of people. And when I talk about teams of people, people who are from all walks of life, who have various backgrounds, various perceptions on how things should be done, while also working towards the common goal, which is to serve patients at their greatest point of need. So leadership is ideal. Definitely need to have that. You also need to have great communication skills, because as a manager, you're not so much doing the work, but rather overseeing the work and really providing the blueprint so that the work can get done. And so you need to be able to communicate effectively, also have great ethics and professionalism. This is ideal because, once again, as the manager, you are the front line for that organization, and you're the representation of how employees should act while they're on the job and what they should be doing in their role. And when things are going wrong, knowing that they can come to you for great advice to get back on track. So great ethics and professionalism is ideal. Now, with that, there are some pros and cons of being a healthcare manager, because sometimes you can become the fall guy for things that may transpire in the organization that you didn't necessarily do directly, but is as a result of a breakdown in your team. And so I really want you, as a healthcare management professional entering this field, to understand what you're getting into. So what are some of the pros and cons of being a healthcare manager? Well, the pros is this is a great way to advance in your career, whether you're starting at entry level management or becoming a senior manager. great career advancement opportunities. Also, there's competitive salaries, so you do get paid on the higher end of the income spectrum. You also have the ability to create impact and make a difference, not only for the teams and people that you lead, but the community members your organization serve. And of course, there's a diversity in job tasks. Now, the cons. There is an increased stress that comes with being a manager in any job, but in healthcare, it's like the stress is on times two. And so, if you are a person who is unable to manage stressful situations, what we call fires, multiple fires at a time, then being a healthcare manager may not be the right role for you. And I'm just going to be really transparent here. One of the reasons why I got out of direct patient management is because I really didn't like it. I really didn't like that I was leading teams of people and I was responsible for everything, even if the alarm went off. So I'll give you a situation that happened. So I used to work for a clinic that was in Manhattan. I had lived in Brooklyn at the time, and the clinic was in Harlem, actually. And the alarm went off like 3 o'clock in the morning. So we did have a burglar system in place. And every day before the last person left the clinic, we would turn on the alarm. Well, the alarm went off at 3 o'clock. My center director, he was nowhere to be found. So the next chain in command was me, the office manager. And when I got the call from ADT, they told me, hey, we don't know what's happening, but you need to go check it out. We don't see anything in the area. Police has been out there, but you need to check it out because something is triggering the alarm. So imagine at 2 o'clock in the morning, I had to get dressed. Okay. I had to take the train because at the time I did not own a car. I had to take the train, the two train. And at nighttime, if you're familiar with New York City, we have the express and local trains. The two train was a local train, and at night they really didn't have any express trains. So I had to take the local train. I wind up getting to the clinic about 3:30 in the morning because the trains are on a delayed schedule, only to get there to find out it was a fly that kept triggering the sensor. So as you can imagine, I was really, really pissed that I had to leave my house, especially because I'm the second chain in command. The sensor director could not be found. That's a different story for another day. But I had to leave my house to make sure that everything was all right. And so that it would stop triggering ADT, because after a certain amount of times, if ADT comes out, they're going to charge you as a facility. So just look at the whole situation. And so when I realized it was a fly, and I couldn't kill the fly because it was flying. The sensor is really high, but I now made the report like, hey, there's a fly. I now have to get back on the train, go all the way back to Brooklyn because at the time I lived in Flatbush, and then get back up to come back to the clinic to open up at 7. For me, that was like some of the final days before I was like, you know what? This form of management is not for me. What other forms of management can I work in? And that's when I started to get into program management. So management is not for the weak. Okay. It is not for the easily stressed. You are the fall guy when things are going wrong, and when things are going right, they're not clapping for you 100%. Okay. They're like, okay, that's a part of your job for things to go right. So if you're not that kind of person who can manage that type of work environment, I don't recommend you becoming a healthcare manager. But if you're a person like, well, this is what I really want to do, then here are the pros. Okay. Another cons is that making difficult decisions is a part of the job. For me, some of the difficult decisions I used to have to make was when it came to hiring and firing people, more so firing people. And sometimes the firing, I just don't want to see anybody out of work. And but I do have to follow protocol. That person was not performing, and according to the director, after 3 write-ups and a suspension, you're fired. So making those decisions, that wasn't always a good thing for me. But it may be right for you. You may find like, no, this is a part of job, it's nothing. But for me, I always like, somebody lose their job. Is there any other way? But I had to make sure that I was adhering the policy and protocol of the organization, exposure to liabilities. And so that, like again, oftentimes a lot of the things that do happen, you don't have a direct hand in it, but because you're the manager, you are automatically responsible when things go wrong. When things are going right, you're doing your job. Really somebody clapping for you. So I really commend organizations who do pour into their managers because not organizations do that. And then balancing competing priorities. Oftentimes, especially if you have a family life, other things outside, or you want to progress in another role, but there is some in office or in organization politics. So like with every job, it has its cons, but the pros do outweigh the cons. And if you're like a person who's like, I really want to be in healthcare management, I definitely tell you to go for it. So let's talk about a few roles. So the first entry level healthcare management job can be a patient access manager, and patient access managers are responsible for overseeing the patient access department. Patient access is the customer service side of the healthcare industry. Their core goal is to make sure that patients are satisfied with the level of care that they're receiving at that given organization. But as a patient access manager, you're overseeing people who may be responsible for verifying insurance or managing a schedule or looking at financial challenges and claims and rejections. Just depends on what your job description is. But patient access deals with patients. Now, at minimum, you need to have a bachelor's degree, but you can have higher. The salary for a patient access manager is about 68,000 to 102,000 plus dollars for what I'm seeing on salary.com and payscale.com. So it is potentially lucrative. And here's where you start to build the profitability of your career and the potential to be promoted is that you can be promoted up to a patient access director. So imagine your manager making 102. What can you make as the director? Okay. So this is a great entry level position that you can enter in. Oftentimes you may have worked another entry level position and now this is a promotion up for you. Or you can be like me who I didn't work medical receptionist jobs. I was able to secure a management position and stayed in management for about 10 years of my career before transitioning into consultancy work and academia. The next role, medical office manager. And as a medical office manager, you oversee the day to day operations of a given clinic or a facility, and you're making sure that the organization stay in compliance with the federal, state, and local and organizational policies and regulations that are in effect. At minimum, as for a medical office manager, you can have a bachelor's degree or higher. The starting salary is about $45,000, and I've seen the higher end to be $75,000 or higher. You can be promoted up in this position. And so the next promotion could be a medical office director. Really depends on the organization and if they offer that role. Then the next managerial role that is entry level is a healthcare project manager. Now, if you are a person who's very much interested in project management, there's room and space for you in the healthcare space. And as a project manager, you're responsible for implementing new projects or strategies and systems to help the overall operations be improved at an organization, because we know that although the healthcare industry does a phenomenal job in serving and delivering patient cares, there are times where we have gaps and loopholes. And as a project manager, you may be responsible to help mitigate or even eradicate those gaps. And so at minimum, you should have a bachelor's degree or higher. The starting salary is about 70,000 per year, or you can get into the well six figures, and you can be promoted up. So the next role can be a project management director. And if you get the project management certifications, that will give you an added advantage point to sell your skills and to secure a position that really pays well, but it also utilizes your skills. Because I don't want to say it's all about the money, right? It is a balance. Well, not necessarily balance, but it's trying to get to a balance between the two. So you're getting paid great and you love what you do. The next role I have is a digital health manager. And as a digital health manager, this is more on the tech side. And there's various things that you do as a digital health manager, but you're really responsible for leading the digital health initiatives at a given organization. And it can vary from EHR audits to implementing a whole new process on how we would collect patient data in a digital space. At minimum, you should have a bachelor's degree or higher. And the starting salary for a digital health manager is on the higher end. So you can start from what I have seen, it's about 80,000, 90,000 to 90,000 plus. So this is a high earning management position, and you can be promoted up to digital health director. So those are the few management jobs that I have seen that are great entry level positions if you are a viewer who's very invested in working in the management side of the healthcare industry and looking for ways to get your foot in the door. The jobs that I shared in this video can be great starting points. But as always, I want to thank you for tuning in to today's episode. Make sure to like, subscribe, and share. And until the next video, bye for now.